My name is Cambria Hodge. This is my speech on addiction, choice, or disease. The war on drugs has become a growing concern today. As the epidemic continues, friends are lost, family is lost, crime rates continue to climb, and families are slowly torn apart. But yet one question still remains. Is addiction a choice or is it a disease? In the beginning stages of addiction, an individual makes a conscious decision to use that drug. Many users begin using thinking they will never have a problem or that it cannot happen to them. That they'll be able to walk away at any given time with no problems, no consequences. There are some that are fortunate enough to walk away because they have not found their drug of choice, while others are triggered at the very first use and will forever fight what is known as the disease of addiction. As usage continues, the chemical balance of the brain is compromised and is ultimately leading to the chemical dependency known as addiction. In this speech, I will show evidence as to how addiction is a disease versus a choice. It has been said that addiction can be hereditary. As an addict comes to the realization that he or she may have a problem, they begin to find different ways to point the blame for their addiction. After all, it is easier to let someone else take the blame for the destruction we've caused one another, or even ourselves. Research shows that addiction can be a hereditary trait. According to the neural markers of genetic vulnerability to drug addiction, it has been long recognized that addictive behaviors run in families, and therefore a familial and or genetic component and that the etiology of addiction has been postulated. In fact, it is now commonly accepted that genetic factors do confer susceptibility to all major addictions. It is also said that the dysfunction of the brain, reward system, and alcohol and nicotine dependence rationales for potential genetic mechanisms. Genetic scientists, by using research, have shown evidence as being an addiction versus a disease. Along with the research of genetics, scientists have also been able to form a theory of addiction being a disease by looking at the brain's chemical balance, chemical imbalance, caused by the chemical dependency and drug usage. Beginning studies would use animals such as lab rats to test the possibility of addiction. They would place the rats in a cage with 2 water bottles. One water bottle would hold a mind-altering substance. The other would be just plain water. As scientists observed the animals, the animal would always choose the mind-altering substance versus the plain water. After watching the animals, eventually they would switch one water bottle to where they would both be plain water. Once doing so, the lab rats would always go to where the bottle was with the mind-altering substance. Ultimately, if the rat would eventually become sick and possibly die because it is going into withdrawal or detox. Research shows that its continued use of drugs can cause a permanent chemical imbalance in the brain. Comorbidity is the cause of addiction by a chemical imbalance. People that suffer from anxiety, depression, ADHD, and other mental disorders are more likely to develop a substance addiction than those without. People suffering from addiction often begin by self-medicating. in an attempt to fix the way they feel. Substance use can also trigger depression. According to the Dopamine and Drug Abuse and Addiction Archives of Neurology, the more frequent or lower the dose of dopamine cause the chemical imbalance leading to the addiction. Dopamine and drug abuse and addiction. Addiction can also be taught as a lifestyle. Some research gives the example of a person being a product of their environment. If a child is raised with two parents who are chemically independent, the chances of the child becoming an addict are very high. With a lack of adult supervision, a child is forced to grow up quickly into an adult lifestyle. Studies show that children are beginning to experiment with drugs and alcohol at the youngest age of 12. This is given from the WISE Communications CDCA training. With the children beginning use at a young age, they're damaging their brain in a vital stage of their life. There are many stories of parents and their now adult children overdosing together. Yet in current times, families are no longer eating together, but they are using together instead. There's a small town in the state of Ohio that have changed the former saying to from a family that eats together, stays together, to a family that uses together, now dies together. Families are no longer spending that quality time. Instead, they are more concerned about finding their next fix. The absence of a parent often leaves a child wondering, where did I go wrong? Why don't they care? Sadly, at this point, the parent tends to not care as much as they should due to their own addiction and begins using with their child. Although a person may be a product of their environment, the chemical imbalance caused in the brain leads to a lifetime struggle of addiction. Like other diseases, doctors try to manage addiction with medical technology and physical maintenance. In the process of recovery, it is important to understand the different stages of that process. When a person begins a process of recovery, they go through a cycle. There are multiple stages in the recovery process. It will begin with pre-contemplation. We'll go through contemplation, then through preparation, action, and maintenance. This is a vicious cycle for the addict. Sometimes the cycle will begin over and over again. The beginning stages of recovery are important in the process because at this time, health concerns and risk are very high. As a person begins to detox, their body goes into a form of shock. Vital signs may even drop at this point. With today's technology, scientists and doctors have been able to come up with a medicine to assist in the detoxing process. During the detoxing process, doctors can monitor vital signs and help prevent the worst outcome of death. Once a person has successfully detoxed, they enter the maintenance phase. Like with any other disease, post-maintenance is imperative. During the maintenance phase, doctors may prescribe a person a preventative medicine. Some of those medicines include Vivitrol, Suboxone, and Methadone. These are all known as opioid blockers. By using Suboxone, Vivitrol, or Methadone, an individual is unable to get high using any opiate. If an individual would use an opiate while using the preventative methods, they would immediately go into withdrawal. By using the preventative medicine, people can put their addiction at bay and attempt to live a normal life. With the use of the preventative medicine comes different side effects. Vivitrol may cause a loss of excessive amounts of weight, and it can also cause depression. After using a Suboxone, a person must be weaned off that medication to avoid another round of detoxing. The argument of addiction being a choice or a disease often sways in a split decision. One way to look at addiction is